Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the brachial plexus. My approach should be on questions and answers. So let's start our questions and get the answers. What are the constituents of the brachial plexus? Or what components constitutes the brachial plexus? The brachial plexus has roots. These are the roots: C5, C6, C7, C8, T1 roots. And it has the trunks: upper trunk or superior trunk, middle trunk, and the inferior trunk. Upper trunk is formed by C5, C6. Middle trunk is formed by C7. Inferior trunk or lower trunk is formed by C8, T1. Then each trunk will be divided into anterior division and posterior division. Okay, so each trunk will be divided into anterior posterior division. Look at that. The lateral cord is formed by the anterior division of the upper trunk or superior trunk and anterior division of the middle trunk. So we got the lateral cord. The posterior cord is formed by the posterior division of superior trunk, posterior division of middle trunk, and posterior division of inferior trunk. That is the posterior cord. The medial cord is formed by the anterior division of the inferior trunk or lower trunk. Okay, we got the cords. Then we'll go at the branches from the cords. So this part is the root, is formed by the ventral primary rami of C5, C6, C7, C8, T1. Okay. What are the roots of brachial plexus? We have just discussed. What do we mean by prefixed and postfixed? Prefixed, we have some contribution from C4 when we have very big contribution from C4 and no contribution from T2, then we call it prefixed. Postfixed, when T2 has significant contribution, C4 has no contribution, then we call it postfixed. Okay, these are variations. How the trunks are formed, we discussed that part. What are the divisions of each trunk? What are the how the cords are formed? How the cords are related to the axillary artery. That is very important. This lateral cord, posterior cord, medial cord. Why we call them lateral, posterior, medial? Lateral cord is lateral to the axillary artery, first part, second part of axillary artery. Posterior cord is posterior to the first and second part of axillary artery. Medial cord is medial to the first and second part of the axillary artery. Okay, we got that. Now we'll go there. Next question. Okay, here. Okay, let me try here. What are the branches of the root? We have some branches coming out of the root. We have from the root we are getting the branches like dorsal scapular nerve that will supply the rhomboid muscle, rhomboid, major rhomboid, minor muscle. Partly the levator scapulae, it may also get supplied from dorsal scapular nerve. Then we'll get contribution to the phrenic nerve. Yes, phrenic nerve. What is the root value of phrenic nerve? Phrenic nerve root value is C3, C4, C5. Okay, but very important nerve here. There is also coming from the root. There is the long thoracic nerve, nerve of Bell. Long thoracic nerve. It innervates what muscle? Serratus anterior. If this is damaged, what will happen? Wing of the scapula. Okay, so we got dorsal scapular nerve, we got contribution to the phrenic nerve, we got the long thoracic nerve, we also get some muscular branches to the longus capitis muscle. That was shown it here. Longus capitis muscle. Also remember that postganglionic sympathetic fibers are distributed with that of the brachial plexus components. Okay, postganglionic sympathetic fibers. Okay, so what are the branches of the trunk? From the superior trunk, we have two branches. Suprascapular nerve supplies what muscles? Supraspinatus, infraspinatus. Okay. Then nerve to the subclavius supplies what muscle? The subclavius muscle. Okay. We got two branches from the upper trunk of brachial plexus. From the middle trunk, inferior trunk, we're not getting any branches. What are the branches of the lateral cord? Very important. This is the lateral cord. We got lateral pectoral nerve. Okay. Lateral pectoral nerve supplies the pectoralis major muscle. We got the musculocutaneous nerve. We got the contribution of the lateral cord to the median nerve. This is called lateral root of the median nerve. Contribution of the lateral cord to the median nerve. So we got 1, 2, 3 from the lateral cord. Okay. What are the branches of the medial cord? This is the medial cord. Okay. We'll get 1, 2, 3, 4, 5. Okay. Medial pectoral nerve supplies the pectoralis major, pectoralis minor. Medial cutaneous nerve of the arm. Okay. It will provide the cutaneous innervation here. Then medial cutaneous nerve of the forearm. It will pick up sensation, pain, touch, temperature from the forearm. Okay, we got that. We got the medial pectoral nerve, medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm. This is the ulnar nerve. It will innervate the flexor carpi ulnaris. It will innervate a lot of intrinsic muscles of the hand, ulnar nerve, and the medial component or medial root of the median nerve from the medial cord component going to the median nerve. So median nerve is getting contribution from the lateral cord, the lateral root. It is getting contribution from the medial cord, the medial cord, medial root. Then we'll get the median nerve. Okay. So we got the branches of the medial cord. What are the branches of the posterior cord? Again, 5 branches. Okay. We have the subscapular nerve, upper and lower. We can say superior, inferior subscapular nerve supplies the subscapularis muscle. Okay. Also the teres major muscle getting the nerve supply from inferior subscapular nerve. Okay. We got that. Then we got the thoracodorsal nerve that supplies the latissimus dorsi muscle. Axillary nerve supplies the deltoid and the teres minor muscle, and the radial nerve supplies a lot of muscle like that of the triceps and coneus and all the extensor muscles of the forearm and hand. Okay, the tendons will go there. Okay, so these are the branches of the radial nerve. So we got 1, 2, 3, 4, 5 from the posterior cord. Okay, so we got the what is Arp's paralysis? Arp's paralysis is a paralysis when there is lesion in the superior trunk or Arp point. These all are damaged. Okay, these two, this and this. This entire part is damaged. Upper trunk is damaged. Then we'll get the Arp's paralysis. Person cannot laterally rotate the arm. Okay, it is medially rotated. The supination will be lost. Okay, because supraspinatus deltoid will not get innervation. Biceps brachioradialis even may not get innervation. Okay, so it will be Waiter's steep sign. Okay, so medially rotated, the hand will be pronated. It is called Wetter's tip sign in Arp's paralysis. What is Klumpke's paralysis? It is a lesion of the lower trunk of the brachial plexus. Arp paralysis may be due to birth trauma, may be due to falling from motorcycle. This part from this part is separated, too much pressure there. Okay. Klumpke's paralysis, even it may also happen due to some type of difficult delivery, or some person is falling from a tree. Luckily, he was able to hold a branch below, and there will be sudden jerk that will lead to damage to the root of the nerve, especially in the lower trunk area. Here, that is the Klumpke's paralysis. Okay, this will lead to claw hand. How the brachial plexus is linked with Horner syndrome? Yes, the post-ilionic sympathetic fiber are distributed along with the branches of the brachial plexus. So we'll get Horner syndrome in certain type of injury to the brachial plexus, especially in the root and trunk area. Okay, what will happen? Manifestation of Horner syndrome: ptosis, drooping of the upper eyelid, miosis, pupillary constriction, anhidrosis, no sweating because no sympathetic innervation, because from T1 sympathetic fiber to the head and neck is not going, so there will be anhidrosis, and there may be enophthalmos. There may be anisocoria. Two people will be different in size. One is myotic, that is this constricted. Another one is normal, the pupil, the gap in the iris. Okay, we got that. Now we'll go to this image. Look at that. This is the axillary artery. Lateral cord is lateral to it. Medial cord is medial to it. Posterior cord is posterior to it. Okay, we got that. Here we got the lateral cord. We got the lateral cord, medial cord, and certainly we'll get the posterior cord. Okay, this is the median nerve formation, getting contribution from both from the lateral cord and the medial cord. Okay, from the lateral cord and the medial cord. Okay, we got that. And our brachial plexus is formed by what? C5, C6, C7, C8, T1. Ventral rami, we have the root. Root is present between the scalene anterior, scalene medius muscle. It is in the neck. Okay, then we'll get this part, the trunk. This is present in the posterior triangle of the neck. Then behind the clavicle, we'll get the divisions. Then the cord will get in the branches will be found in the axilla. Okay, this is the axillary artery. So we got the median nerve, we got the medial cord, we'll get the lateral cord here, lateral to that, posterior cord is posterior to it. Okay, we got that. Okay, so which muscle paralysis is called wing scapula? That is the serratus anterior. Nerve supply, long thoracic nerve. Root value, C5, C6, C7. Which nerve does innervate serratus anterior? Long thoracic nerve or nerve of Bell. What is hand of benediction? If the median nerve is damaged above the elbow joint, what will happen? When a person like to grip, the second and third finger is not totally gripped. That is called the hand of benediction. What nerve lesion causes wrist drop? Wrist drop may happen due to damage to the radial nerve. It was in the old time, it was a manifestation of lesion of the radial nerve due to lead exposure, lead painters. It is not present now. Any damage to the radial nerve suppose in the radial groove, okay, if there is fracture in the radial groove, then there will be wrist drop. Person cannot extend the wrist. Okay, that is the wrist drop. Which nerve compression leads to Saturday night palsy? It is the radial nerve. This is the radial nerve. Person in the Saturday or any other day, not necessarily Saturday, person he may get some alcohol. He is on the armchair, two hands dangling by the side of the armchair, and that is compressing the radial nerve in the radial group or spiral group that will lead to Saturday night palsy. Okay, what lesion causes claw hand? It may be due to damage to the lower trunk of brachial plexus, or it may be just damage to the ulnar nerve. Okay, so there will be intrinsic muscle, interosseous muscle, lumbrical muscle, that will thinner muscle. I mean, mostly ulnar nerve, hypothenar muscle, median nerve. We have also damage to the thinner muscle. So intrinsic muscle will not work. We call it claw hand. It depends on where the site of lesion. Is it in the lower trunk or is it in the ulnar nerve? Both way possible. So median nerve damage may also cause claw hand. Okay. And that's all about the question and answer about the brachial plexus. Please go through entire brachial plexus. This is very important for your exam. And I don't like to go through the mnemonics because I may confuse with a lot of mnemonics. So I will request every student to draw and label and open the atlas book, and please get these answers handy. And if you have any question, please feel free to ask me, and please share the information with your friends. Please support my channel. Please subscribe me, and have a nice day. Bye now.